We are going to see a table about all the hepatitis viruses like A, B, C, D, and E in that order. So the first we're going to see some 10 things. Okay, so the first one is incubation days. 15 to 45 days is hepatitis A. 30 to 180 is hepatitis B and D. 15 to 160 is hepatitis C. Hepatitis E is 14 to 60, that is 14 to 60. Okay. So if it's all kind of like the oral route, it's going to be somewhere between 2 weeks and somewhere 2 weeks and 2 months, which is like 2 weeks and 2 months. That is hepatitis A and E. If it's going to be hepatitis B and D, it's going to be 1 month to 180 days is 180 divided by 30 is going to be 6 months. Okay, so 1 month to 6 months is hepatitis B and D, and then approximately the same thing, but like from 2 weeks to 160 days. Okay, that is hepatitis C. That was about the incubation days, and then moving on to the onset. Acute onset is in case of hepatitis, everything is acute in onset except for hepatitis C, and then hepatitis B and D also are insidious onset. Hepatitis C is also insidious onset. All are acute onset except hepatitis C, and hepatitis C has insidious onset. Insidious onset is for hepatitis B and D as well. Moving on to the transmission. Fecal-oral transmission is for hepatitis A and E. Percutaneous transmission is unusual in case of A. It is present in case of B, C, and D. It is not there in E. Sexual transmission is there for hepatitis B and D for sure. It may or may not be present in AC, but it's not present in hepatitis E for sure. Perinatal transmission is present for hepatitis B and also D, but like B, it is like the thing. And then it may or may not be present in case of C. It is not there in case of hepatitis A and E. Age preference, children and young adults are going to be affected. Okay, children are going to be affected by hepatitis A. Young adults are going to be affected by A, B, and E. A and E and B because A and E because like they try a lot of food outside, and then B because they are trying sex newly, and then yeah, so hepatitis D is going to be same younger dose. The age similar to HBV, and then any age in case of hepatitis C, but it's common in adults. Clinical features, severity is going to mild one. The hepatitis A and E are mild. B and D are occasionally severe. C is moderate. Progression to chronicity. No progression in case of A and E, but it's occasional in case of hepatitis B, and it's common in case of C and D. Okay, 90% of the neonates and 1 to 10% occasionally it is going to get progress to chronicity in case of hepatitis B, 85% in case of C. Carrier state, there is no carrier state for A and E. Variable carrier state for hepatitis D because like it's just like the okay, and then 0.1 to 30% carrier state in case of B, and for C is 1 to 3 percentage. Hepatoma formation, it's not seen in case of A and E. It may or may not be seen in case of it may be seen in case of hepatitis B and C. It may or may not be seen in case of D. Neonatal infection is associated with hepatoma and hepatitis B. B for banana. Prognosis is excellent in case of hepatitis A, good in case of hepatitis E. Okay, and in case of D, if it is acute, it is good prognosis, chronically poor prognosis, moderate prognosis in case of C, and for B for banana, it's worse with age. Prophylaxis in hepatitis A க்கு வந்து IG is given, inactivated vaccine is also given. For hepatitis B, we have HBIG and recombinant vaccine. HBV vaccine is given for hepatitis D as well. No vaccine for C and E. Therapy, no therapy for hepatitis A and E specifically. For hepatitis B, we have adifovir, interferon, pegylated interferon, lamivudine, telbivudine, entecavir. And then hepatitis C, we have to give ribavirin. All the above along with ribavirin, pegylated interferon and newer drugs. Interferon may or may not be given in case of hepatitis D. Okay, so like if you're going to treat B, it's going to get cured. Thanks.